How's everyone doing today? Can you hear me? Can you hear me right? My name's Steven Keating, and I'm a grad student here at MIT. And I like to start with this slide because going through this experience has made me realize this is what's most important. So this is what my brain looked like in the summer. And this talk I gave about 3 weeks ago here for the first time. Today's talk is going to be very different. We're going to dive deeper into it. I'm going to show you surgery video. We're going to talk about the power of open source data. And I'm going to show you lots of 3D printed copies of my brain. So it's going to be fun. I am very optimistic and positive about my situation. I wore a pink shirt today to try to brighten the mood for you all. But it's a very active situation for me. This was me 2 days ago at the Proton Beam Center at MGH. So it's actually a crazy 3-story tall cyclotron. And it's got this crazy Halloween mask they give you to hold your head really still. So it's a very active situation for me. I'm going to be starting proton and chemotherapy in a few weeks. But today's story, I want to talk about curiosity, how it's changed my perspective, and really would love your thoughts on open source data. So I want this to be a very open discussion. Any question is fair game. Usually I work in 3D printing, trying to make buildings, 3D printing microfluidics, and even doing my minor in synthetic biology, so working with actually using organisms to grow materials. But today is a personal story. My work has nothing to do with IDH1 cancer. But it does date back to curiosity. So I just wanted to see my brain in 2007. Pure and simple, I was curious about what my brain looks like. So I did a research scan, and I asked for the raw data back. And they said, by the way, it looks like you have a small abnormality in your frontal lobe. You might want to get that checked out. So I went back and got a real MRI to look at that exact region. And they said, don't worry, 5 to 10% of people have a brain abnormality. Get it checked in a few years, see if it changes. So that worried me, and I got it checked again in 2010. And it hadn't changed. And so they said, don't worry, you're totally asymptomatic. This looks like just an abnormality. You might want to keep an eye on it, but don't worry. So it was because I was curious just to see my brain that we found that. Now you guys are all probably thinking about your own brains, which I encourage you to do research scans because it'll help science. And then in summer, I actually started to smell a very faint vinegar smell, only for about 30 seconds, and it happened about once a day. And it was so minor, I would be having a conversation with people in my lab, and they would have no idea that I was going through what actually is a seizure. Very, very minor seizure. So because I knew I had this abnormality, I thought to myself, this might be related to this. I should get this checked out. I went for my first time to MIT Medical in 4 years and found a doctor and said, I need to get another MRI. And I actually had to make a bit of an argument for it, but the MRI got booked a month out. And I went back to Canada. I'm from Canada. Went back to Canada for 2 weeks, and these seizures stopped. So it's a very either I was getting more sleep or less stress, or maybe it's because I was drinking alcohol with my friends, but the seizures stopped. I came back to Boston, they started right away. So I went in and got an MRI, and this is what they found. And they said, you have a baseball-sized tumor that needs to come out right now. The good thing was I was still very asymptomatic, so they actually were able to plan the surgery. So I was listening to Ed Boyden talk the other day. One of the amazing things is at MIT, I can actually interact with these world leaders like Matt in cancer. And Ed Boyden said there's about 100,000 neurons per cubic millimeter, which gives my tumor about 12 billion neurons lost, which is about 12 trillion synapses. And as a quick note, most of your modern day laptops have about 1 billion transistors. Okay? Now, I'm not saying a synapse and a transistor are equivalent, but there's been papers that show it takes about 400 transistors to model a synapse. So think about how much of the actual computing power I lost that day, but somehow I still feel great. So this is actually the size of my tumor. I'm going to pass this around. So one of the nice things is that work in digital fabrication, and with some colleagues, we're able to do some really cool 3D printing examples. That's the real size of the tumor, which is actually massive. It's kind of funny. So people say the frontal left lobe contains personality, which means technically I have no personality now, which, that's what people have been saying all the time. So I also want to show you some other cool prints. This is done with some colleagues at the Wyss Institute. And these ones are multi-material based on the real MRI data. So when you put a light underneath it, you can actually see all that data. And I'll just show you this quick video. I'm going to pass these around as well. You can actually visualize that whole data in 3D. And we can print it with variable elasticities too. And the tumor actually has a very different stiffness than the rest of the brain. So it's very, very interesting. I'm going to pass some of these around right now as well. Just to have a look. So lots of fun stuff. You can even do angiograms. So this is all the blood vessels in my brain. Kind of interesting. They'll pass these around. Feel free to check them out. So having that data for me was very, very important to understand what I was going through as a patient and to actually see if any research could be done in that field. Pass those out. So yeah, the best place to fight cancer is MIT and Harvard. So it's great to be here. You guys should feel very lucky that we're at MIT and Harvard. The resources, the connections, and even the insurance has covered it all. So thank you to my friends, family, and girlfriend. Thank you, to the research community, which has been incredible. And thank you especially to my advisors, Neri Oxman, David Wallace, and Dr. Yuval Fink. I want to tell a quick story about how my diagnosis happened. When I found out, I told my advisors the same day. They followed up and they said, we want to find the best surgeon for you. We took the data, we open sourced it, we sent it out to the neurosurgery colleagues around the US and said, who's potentially the best to do this? Got connected to that doctor who was Dr. Ino Kioka at Brigham Hospital, and he did the surgery. So we were able to plan that out, and open sourcing that data really made a big difference. So not only did open source data help me find my tumor in 2007, but it helped me figure out the best method of treatment. So it was done in the Amigo suite, which is one of the most high-level robotic surgery suites in the world. And we're all, again, lucky to be in Boston because it's the center of not only the research, but the actual applied medical science. So it's an awake brain surgery. The tumor was actually below healthy brain matter. And they were very worried about cutting my language center. So they had me awake for the surgery, and I was talking to them about all kinds of things, about my day, about my girlfriend, about my classes, and they were in there cutting out my brain. So quite an experience, a very weird thing to actually lose the ability to think of words. So then they were making cuts and probing. My language would get garbled. I wouldn't be able to think of words. I could only think of colors. And I wanted to see if you guys are up to see the surgery because I would actually love to show you it. I'm an engineer, and I love seeing how things are made and done. So I'm going to warn you, this is going to get graphic. If anyone does not want to see this, I definitely recommend closing your eyes or leaving. Dr. Kioka and his team were amazing and allowed the surgery to be videotaped. So I'm going to cruise through this very quickly. This is the actual surgery room here. I don't know where that noise is coming from. So I'm going to cruise through this. We're going to go very quickly, and I'm going to give you a very high-level view of what brain surgery actually is. They're all waiting for me to come in. Here I am. Actually, everything is motion tracked, which is really interesting. See all these white balls? They're tracking not only the position of my head, but the position of their tools, and they're corresponding that to the MRI data. So here they are scanning my head, putting on the iodine, making things are clean. Now they're going to go in and actually make the first cuts, and they do it with just a scalpel. And believe it or not, it's like peeling the skin off a doll head. They can push it back, and they basically made a cut right along my head here and opened it all the way up. So there's my skull, and it's pretty incredible to see that, I don't know why that audio is having issues. Here's the MRI screens that they're corresponding their tools to, and they go in and they take a drill. So here's actually the MRI data, right? So here you can get, if we pause this, you can get a good look at the tumor size and how they're actually having to come in and cut healthy brain matter. So if you look at the bottom here, you can see they're going to come in, cut through healthy tissue to get down to the tumor. So they take a drill, they make a hole in the skull, make another hole, and then they actually take what kind of looks like a Dremel, believe it or not, a medical grade Dremel, and they actually cut right through the skull like that, and they're cutting out kind of a jigsaw piece, and they go in, and here actually comes out the skull. So there's actually the skull coming out, and there's my brain underneath. So there's the dura, and they're going to cut through that. So here we go. They're actually watching this on the MRI screen. They cut open the skin, and there's the brain right there. And if you look, you can see it pulsing. And now they're going to actually take this electrical probe here, and I'm awake for this, and I'll show you the audio in a second. And they're probing the brain to figure out where my language center is and where they want to make the cuts. So this was not painful at all. It was actually quite a bizarre experience. The weirdest drug experience you can have, let me tell you. So they figure out where they want to make the cut. They start making the cut, and they continue through, and now they're getting to the actual tumor. So let me fast forward here. You can see this white material here. That is actually the tumor. And so it has a different consistency, and they're starting to make small cuts to pull it out. And let me continue on here. There's one chunk they're about to remove. They kind of removed it in 4 chunks around the size of golf balls. So continuing on with the surgery, they go deeper and deeper, and I'm going to fast forward through a lot of this because it took them 10 hours to do this. And whenever they wanted to check on how it was going, one of the neat things about that room is it has an MRI system that can robotically come in. So for example, here's the room, and you see that? There comes that MRI coming in. My brain is still all open, and I'm doing a scan, and then they'll say, okay, we need to get this part and this part and this part. So they continue on, and I'm totally knocked out now. I only remember about 20 minutes of the surgery, to be honest. And the other interesting part is how they finish it. So let me get to the very end here. This is where they're sewing me back up, and they go in, they make the basically stitches together, and you'll see here, there's the final cavity that they left, and that's a hole in my brain right now. Somehow I'm still talking to you. And they put it all back together, and here comes the skull back in, and it's got these titanium plates. And as a mechanical engineer, I found it very interesting that they take basically a Phillips screwdriver and screw me back together. So pretty interesting. And then they stitch it back up, and you always kind of forget, but there is a person underneath there, and there I am. And this was also one of the things that I found quite interesting, was how they were holding the head. So see that vise there? That's what's keeping my head really still. Watch that top one. Look at how deep that's going to go in. See that top piece up there? So it's pretty deep, and they just push that in. And so I'm awake during this part. My eyes are open, as you can see. So very, very interesting. And that's the surgery video. And I wanted to quickly show you, they also took a cell phone video, which was really amazing of them to do. I really appreciated it. I was very excited that they were allowing this to happen. And if you listen, I don't know if you can understand that because I'm wearing a gas mask, but I say that I'm working on a 100-foot 3D printer, which is some of the research that I did. I'll play it one more time just in case you want to hear a person with their brain cut open. So anyways, there's 10 hours of that video, and I talk about some very interesting and quite quirky things. And I'm happy to dive into it more later if you guys want to. So this was me 3 days after surgery. Within 1 week, I was back on MIT campus and actually running meetings again. So the brain is the most incredible thing. And this experience has been so enlightening on so many levels. It's been almost an involuntary cleansing. And it's really changed my perspective. This is what the brain looked like in the summer and then after the surgery. I'm obsessed with data, and so as I'm in synthetic biology, I went and was able to look at my actual tumor cells under the microscope and actually look and see kind of the faded blue glial cells are the ones that are actually cancerous and that are dividing, and the red lines are the axons. And like Matt was saying, we're actually able to use some of the latest research techniques because we're here in Cambridge and look at the 2HG. So the 2HG, this is a mapping of it with the MRI spectroscopy done pre-surgery. So you can see the red area is where there's a lot of 2HG. And then post-surgery, there's actually a very, very minimal signal there. But still, the recommendation from everyone is proton and chemotherapy combined. So I will be going under that treatment December 10th coming up soon. And it's a pretty crazy machine. I'm kind of excited to see what protons look like. I've heard that it's an interesting experience. So what changed when you lose a huge amount of your brain? Basically bigger than a monkey brain was cut out of me. Thousands of computers worth of computation. Luckily, not much that I've noticed. Can everyone hear? We can put the mic back on if you'd like. Is that better? Okay. So not much has changed. The biggest factor is sleep, to be honest. So right after the surgery, I could only sleep for about 3 hours, and I would wake up in a very odd way. I'd wake up with too many thoughts. And it's a very hard thing to describe, but I'd wake up with just random thoughts, but way too many of them that I couldn't fall back asleep. And it was almost like an alarm clock every 3 hours. Luckily, that is improving. A couple odd things have changed. My hearing perception has actually gotten a little better, as far as I can tell. I used to listen to my iPod on 100%, now I listen to it on 50 or 60. So maybe it's just my perception that has changed. The tumor might have affected that somehow. And my hands and my feet get colder faster. So some slightly odd things, but what did I learn? I learned a lot, and I think this is very important to have patient data, and not only to help the patient heal, but to help the community and my support network heal. So, blood work, video of the surgery, genome sequencing, mouse models, microscopy, computer analysis, and a new interest in open sourcing healthcare data. And this is what I would love your thoughts on. To me, why can't a hospital just have a share button? I couldn't believe how difficult it was to get my own data. So patients have a right to their own data, and Brigham and MGH are actually really good at providing that service. So they're at the top line, but it was still very difficult. So I could go ask for the data, and I'd get it in 30 CDs. And unless you know what you're doing with digital data, it's very hard to explore those CT scans, those MRIs. Why can't patients have the ability to share it if they want to? So I'm a strong believer in privacy, but if the patient wants to share, they should be able to. I think it can help science, the community, and patients most importantly. So I found it very funny that actually yesterday, the Large Hadron Collider open sourced all its data. So it's easier for me to access the particle physics data than my own medical data. So I might be able to find some new subatomic particles from the world's most expensive experiment, but I can't look at my own data in a very easy fashion. So how can we make that better? How can we share that? There's definitely a lot of activity in the area. I've been lucky enough to meet with some of the top people at Sage Bionetworks and Synapse, Personal Genome Project, and they're all amazing projects, but it's still not able to happen directly from the hospital in an easy manner to put all the data up. I really, really feel strongly about this, and I'm looking forward to hearing your thoughts, and if anyone wants to help with this, I would love your suggestions. I had to make my own website, and I posted all my own data. So if you want my tumor to print, or if you want my MRIs or anything like that, it's actually on my website. But it's amazing to me that that can't be shared in a better fashion. So open data benefits patients. Imagine having your whole medical record that you can not only share with doctors, but with friends and families. Doctors can get second opinions very easily, or patients can get second opinions very easily, and doctors can follow what leaders in the fields are doing. Scientists, of course, there's hundreds of millions of patient data records in hospitals, and they're all siloed because of informed consent. What if the patient wants to share? It could be a huge benefit. Exome sequencing is now standard of care. Communities, so in terms of sharing the story and healing, it has been an amazing experience to understand what is happening to me. And finally, hospitals. I think having feedback could save a lot of money and do incredible things. So I don't understand why it's not there yet. I know it's coming. We're going to have Apple Watches and everything monitoring our health in real time, and there's going to be a way that that's collated. I just hope it's open source and not closed source. So I'm very interested in hearing your guys' thoughts on that. And I think data is fascinating in general. So this was a extra part of a CT scan of me the other day. And yes, I have some terrible dental work. That was from, I was in a school-endorsed breath-holding competition in high school on concrete, and I held my breath too long and passed out. And hence the amazing amount of dental work. But if you look at the top right, you can actually see where they did the skull surgery. And you can see those connections. So data is fascinating, and why can't the patients be curious about themselves in that regard? I think it has amazing healing power. This was actually the CT scan that was just done a couple days ago, and note that I had all that dental work done, so watch when they get to the teeth, it's actually going to scatter the x-rays. So as we're progressing through, we're coming to the teeth right now, and you'll see it in just a second. There's my nose, and there's the teeth, and then, oh, there's all that scattering. And that's interesting, right? You know, having that ability to understand yourself, I think, is very important. And I think curiosity is the reason we're all in this room as an academic community. So this is what I learned, but most importantly, it was the perspective shift that probably was the biggest change for me. You know, if you're told you have 2 weeks before you might die on the table, it's a very powerful statement. So final thoughts. I sent out an email to friends and family before that surgery. I wanted to share a couple things from it. These are very honest words. Perspective is everything, and switching shoes yields the most powerful thoughts. Families and friends are what remain when the world blurs. Believe it or not, I was talking about open data in my last words. Gather data as often as possible and share it with the world. It could save your life one day. I never would have gone to the neurological folks if I didn't have the open data from that research scan. And as an academic community, we all publish papers, which is amazing. So it really is open source, and I just wish that could be extended all the way to patients. And then finally, the world is a lovely, splendid, and fascinating place, but most of all to me, it's beautifully curious. So a lot of people to thank, a lot of professors here leading the field, and of course an amazing medical team. And I want to end on a happy note. When you open source your data, it gets places. And this is what I saw 2 days before my surgery. I don't know him. My friends don't know him. But apparently friends of friends found Jimmy Kimmel for me. So,
hey Steve, it's Jimmy Kimmel. I hope you have the best brain surgery ever, and then you can wear a really big hat like this one.
And so open sourcing the data can lead to all incredible things, including Jimmy Kimmel finishing a cancer lecture at MIT. And I'm taking his advice, and I've got my Boston hat to show a little Boston love, and I'd love to thank you for your time.